Hey, can we start with this idea of just how many people might be out there in the community not showing symptoms who still might actually have coronavirus? That's a bit of a worry you've been looking at.
Yeah, they're called people have spoken before, and we have two of asymptomatic people who are either pre-symptomatic, they're about to get symptoms, or they don't get symptoms at all. But in fact, increasingly they're being defined as undocumented cases because it's not as simple as that. They've got no symptoms, or about to get symptoms, or they've got no symptoms at all, and they've got mild symptoms, and they just don't present for testing, which is understandable if they've got no symptoms, or feel that the symptoms are so mild they don't need to bother. And researchers have looked at China, and they reckon that 80% of the total burden of cases, not the ones you've detected, but if you look at all cases, 80% are undocumented. Similar findings for the United States. The state of Indiana has looked at this with a survey, a random survey of the population, doing throat swabs, nose and throat swabs, and blood for antibodies, and found that 11 times as many people in Indiana have had the infection than the ones picked up by tests. And who knows what it is in Australia? It could be anywhere between 2 and 4 times as many people have the infection. And the worry, of course, is that, and this is the underbelly, if you like, of why the Premier, Chief Health Officer and others keep on calling for people to come forward for testing, because you've got to get that undocumented group as small as possible. But it really could be, double, 4 times as many. We just don't know at the moment.
And you make the very salient point, Norman. The authorities in that sense are flying blind, aren't they?
They're flying blind in more than one in more than one area, and it's not entirely transparent, the numbers that are coming through. Not necessarily anybody's fault, but there is a backlog of cases still under investigation, and it's large. And we still don't really have a good fix on how much. And remember, what you're seeing today happened 5-10 days ago in Victoria and New South Wales. It's not what's happening today. And they don't know really yet how much community spread there is from unknown sources. They're hoping it's very small. They're saying it's very small, but they can't be sure until they get rid of that backlog. And so there's 2 things. One is undocumented, and the other is people you've already tested, but you don't know necessarily yet where they got the infection from.
Yeah, because the delay in sort of getting to all those contacts, that tracing seems to be stretching out, given that we now have thousands of cases that are still being investigated.
Yeah, it's an enormous infrastructure required. It requires centralised data, hard work and persistence, and, as we now know in Victoria, door knocking.
Now, let's go to the story that is getting some hopes up this morning. That is the words from Brett Sutton, the Victorian Chief Health Officer yesterday, who said that he had seen modelling that suggested yesterday that the more than 500 cases could have been the peak, and the trend will start going in the right direction, as in down from now on. Is it too early to get hopes up, given how unpredictable, Norman, this virus is?
This virus, you're right, Michael. This virus finds any chink in our armour, and modelling does not predict the future. It gives you a sense of where you might go, what you might do, what might make a difference. Just to give you an example, if you don't know where the documented cases are, you don't know where the gaps are in your testing regime. The positive rate for testing in Victoria is now up to 3%. It's been under 1%. That means that they're probably not casting their net wide enough here to find all the cases. So there's a problem with testing as well as contact tracing. So all these variables add up, and you've got these wildfires in aged care. And spread, for example, in the NICU at Royal Children's. It is too early. I don't want to be a Cassandra here, but it is too early to say.
Just on the aged care matter, the Minister Greg Hunt earlier was saying, look, there's all these reasons why we're seeing what we're seeing in aged care, and not suggesting that there's been too slow to act. What's your take on it? I feel like we're repeating the same story headlines that we were with Newmarch a couple of months ago.
Yeah, and the Aged Care Royal Commission's been hearing problems with aged care now for some time. It's been extended. This is a problem, and the Minister can talk about this, and they are taking measures to try and sort it out. But there's a fundamental problem with aged care, with casualisation of labour, with undertrained staff, with centres that have with aged care homes who have all the paperwork right, so they've got all the plans, but they haven't implemented them or don't know how to implement them. For this to have affected so many aged care centres, aged care homes, there is a huge problem, and it's a massive area of vulnerability. And we can't paper over these cracks. Something's going wrong here, and it's almost certainly a lack of expertise, a lack of medical and nursing expertise in these residential aged care homes, and a lack of implementation of plans.
Norman Swan, always good to talk to you. Thank you.
My pleasure.